Welcome to this webinar on Changing the Landscape, a new and award-winning resource for preventing violence against women and girls with disabilities, presented by Our Watch and Women with Disabilities Victoria. My name is Akii Ngo, my pronouns are they, them, and I'm absolutely honoured to be the host of today's webinar. The Changing the Landscape practice resource and framework for action won the National Disability Awards for Excellence in Innovation. So congratulations to Our Watch and Women with Disabilities Victoria on this incredible achievement and this great work. We have an impressive lineup of speakers and panelists joining us today. So firstly, thank you to them for joining us and for sharing their wisdom, lived and living experience and expertise with us. And a huge thank you to all of you for coming to today's webinar. We have close to 300 people registered today, which is absolutely amazing. And I sincerely want to thank each and every one of you for all making time today to learn more about preventing violence against women, girls, and people of marginalized genders with disabilities. As a survivor advocate and activist of intergenerational, intimate partner, family, domestic, and sexual violence, I am deeply grateful for all this work. Before I get stuck into today's incredibly important webinar, I would like to open the session by acknowledging the traditional custodians of the lands across Australia on which we work, live, and play, paying our deep respects to Aboriginal and Torres Strait Islanders' history, cultures, and knowledge. I would also like to acknowledge any Aboriginal or Torres Strait Islander people joining the session today. I would also like to acknowledge the women organisations, and survivor advocates who have shared their experiences and fought for their rights about this issue for decades. The work that we are doing here builds on their legacy, their dedication, and their advocacy that has preceded us. It is critical that we continue to learn from and include the lived experiences of women, especially First Nations women, when preventing violence against women and girls with disabilities. I would also like to strongly and wholeheartedly recognise the impact of intergenerational, domestic, family, sexual and intimate partner violence, and the impact that it has on individuals, families, and communities. I acknowledge the strength and resilience of the children, young people, and adults who have and are still experiencing violence in all of its forms, and we hold space for those that have survived, are surviving, and are surviving the devastating impacts of gender-based violence. I'd also like to recognise and remember those who did not survive. So before we get into today's wonderful panel and the great discussion today, I'd just like to let you know a bit about myself. My name is Akii Ngo, my pronouns are they, them, and I'm absolutely honoured to be the host of today's webinar. A huge thank you to Our Watch and Women with Disabilities Victoria for having me. As previously mentioned, I am a survivor advocate of numerous types of violence. And in fact, my spinal injury and constant debilitating pain that I live with each and every day is a direct result of intimate partner violence. So I am glad there is prevention work focusing on women and girls with disability, as it is a cause very close to my heart. I'm a first-generation Aussie with refugee parents who come from a culturally and racially marginalised, non-English speaking background. I've experienced an entire lifetime of ill health and presently live with numerous chronic illnesses and degenerative disabilities. I'm a proudly multiply disabled, multiply neurodivergent, autistic ADHD and CPTSD, queer, LGBTIQA+, trans, non-binary person of colour. My background is in public policy and health promotion, and I'm very passionate about human rights and intersectionality. So I'm so thankful to be here today as the host, but also working with such incredible organisations. I've dedicated my career to making a positive difference and contributing my lived experiences to various works around the country, including on the Domestic Family and Sexual Violence Commissioner's Lived Experience Council. So I thank everyone for their contribution and work on this incredible Changing the Landscape project. So moving on, I'd like to go to today's accessibility features. We have a number of accessibility features that we've built in the event today that include live captions, which is available for this session. And if you would like to access that, you can access it through the Zoom menu on your device. We have Auslan interpreters who are visible on the screen along with each speaker. The information is also available in the chat box, along with a Word document, which is a screen reader accessible version of the slides being presented today. If you have any questions at all or require any assistance, please use the chat function to send Jess, our wonderful digital support person, a message. I'd like to recognize that violence against women is widespread and touches the lives of many people, and support lines do exist. We acknowledge that the content discussed today may be distressing. If you feel at any time any distress or need some time out, please take a break if needed. You may want to chat with someone following our session. You can contact 1-800-RESPECT, which is 1-800-737-732, or text 0458-737-732. You can also contact 1-800-RESPECT via the National Relay Service. You can contact relevant numbers and ask for support. The supports will also be available in the chat. Alternatively, you can use the web chat function, which is available 24 hours a day on www.chat.1800respect.org.au. There's also a Sunny app, which is 1-800-RESPECT's app for people with disability who have experienced violence and abuse. Sunny has been co-designed with women with disability and can be downloaded for free on the App Store or the Google Play Store. There are also support services for men seeking support about relationships, anger, or mental health. You can contact the Men's Referral Service on 1300-766-491. Further to this, there's Aboriginal and Torres Strait Islander people can contact 13-YARN, that's YARN, and also for LGBTIQA folk, QLife provides support to all members of the Rambouillet community on 1-800-184-527 or qlife.org.au. And as mentioned, these links and details will be provided to all of you in the chat. To continue our session, I would just like to go over a code of conduct. Our Watch is committed to facilitating a culture of learning that promotes responsible and ethical behaviour. Our Watch has a zero tolerance approach to behaviour from the webinar participants that is discriminatory, derogatory, violent, insulting, or explicit. In the event of these behaviours, Our Watch will enact measures to ensure the safety of participants, which may include deleting comments and or removing people from the webinar if required. Just a bit of an overview for today. So in July 2024, Our Watch and Women with Disabilities Victoria launched the new suite of Changing the Landscape practice resources. Our Watch and Women with Disabilities Victoria partnered on this project, which aims to support prevention practitioners, disability professionals, governments, and the broader society to prevent violence against women and girls with disabilities. This project was the translation of evidence from the Changing the Landscape framework into a suite of videos and audio resources and infographic posters. These resources center the lived experience of women and girls with disabilities and were developed through an inclusive co-design process and focus on transforming the evidence into action or strengthening intersectionality in primary prevention work. This webinar will support people doing primary prevention work who want to strengthen their understanding of preventing violence against women and girls with disabilities and incorporate new practice resources into their practice. We also welcome any disability advocacy professionals, educators, and or victim survivors who may be joining us today. For Q&A, we will have time at the end of the session for questions. So if you do have a question, please use the Zoom Q&A function at any time and indicate who the question is for, and we will endeavour to address as many questions as we can. So now it is my absolute pleasure to introduce Tess Whelan from Our Watch and Lena Molnar from Women with Disabilities Victoria. Tess Whelan, whose pronouns are she, her, is the Disability Sector Advisor at Our Watch and was part of the team who developed the Changing the Landscape practice resources over the past 2 years. Tess has enjoyed working on a range of projects and programs throughout her career, with disability inclusion being a particular passion. Dr. Lena Molnar, pronouns are she, her, and Lena is the Research and Evaluation Lead for Gender-Based Violence at Women with Disabilities Victoria. Lena's research has focused on social movements, violence prevention, and Youth Studies. She currently manages programs relating to primary prevention, disability and gender-based violence, as well as disability-inclusive sexual and reproductive health. Lena's led WDV's partnership with Our Watch through the development of Changing the Landscape practice resources. Tess and Lena will be discussing an overview of the drivers of violence against women and girls with disability, an overview of the inclusive co-design process that was employed in developing Changing the Landscape practice resources, and a summary of the various resources and their purposes. Thank you and welcome to Tess and Lena.
Thank you, Akii, and thank you everyone for joining us today. So Tess and I were talking about how best to present these resources and to introduce everyone with what we've co-designed in bringing Changing the Landscape to life. And we thought the best way to do this was to give you all a taste of some of the resources. And what we have on this slide is about unlearning ableism and gender inequality, which we'll go into unpack a little bit more. So we just wanted to centre the lived experience experts that drove these resources into life. So in this video, you will hear from Laura, Renee, Christine, and Annabelle about how they understand the impacts of ableism and gender inequality. Nat, if you can press play, please.
Ableism is a set of attitudes and behaviours that revolve around or are based on the notion that people with disability are inherently somehow less than people without disability.
Another way to describe it is organising communities towards people without disability.
Having lower expectations of staff with disability, or it might involve thoughts that, for example, making something accessible is just too difficult, so we won't do it.
Gender inequality. I feel like it's the elephant in the room. It's something that everyone's aware of, people don't want to talk about.
Gender inequality I would describe as not just a belief, but an environment, a system where women and non-binary people are perceived as being subservient or lesser than.
Disparities might be apparent in the economic sphere. We know that there's a massive gender pay gap. Disparities might also be apparent in the healthcare system, in the way that people of different genders are treated when they access or attempt to access healthcare. They might be apparent in the educational sphere, say when by virtue of their gender, a young person is encouraged to study particular subjects, even if their interests don't lie in those subjects.
Most drugs that women use are only tested on men. They're not tested on women. And then we wonder why they don't work for us.
Paternalistic attitudes and attitudes that infantilise us or treat us as though we are children who need to be looked after, who can't make decisions for ourselves, who I guess are in that way deprived of agency over various decisions or in various domains of our lives. Actions that perpetuate ableism can range from things that are really innocuous and might pass by unnoticed. Some examples that I've experienced are people staring at me when I'm walking down the street, people coming up to me and just saying, "What's wrong with your leg?" or "Why do you walk like that?"
The gaslighting is definitely a massive, massive problem. Just not believing me, believing that I would rather lie about needing a wheelchair than actually needing it. And, you know, the amount of energy and time and distress and sadness that comes from not being able to take my child to a park or to, you know, an environment that they want to go to because my wheelchair doesn't fit, and not being able to pay for a new one and having to beg constantly to get access to what is a basic human right. Like, you know, access to things is a basic human right.
Our world is basically designed through a system of patriarchy, which favours men. Unfortunately, it's just been like that for a very long time. Add on top of that the fact that architecture in the world and a system designed that favours mostly men also only favours mostly able-bodied people. And I think that's why other people who aren't disabled don't understand. But a lot of people think that they're ticking a box, but providing disabled access is not about that. Equality and equity is certainly not about that.
It's a really difficult thing to live in a country where you know that 6 out of 10 people don't think that you deserve choice and control over your own life.
Women and girls with disabilities are affected in a quite sinister way when ableism combines with gender inequality. When you've got a situation where, especially with women with disabilities with a male partner, the male partner might be influenced by society that they're better or more than because they're a man to start with and they're able-bodied. That puts the woman with a disability in a more inferior position. It makes them vulnerable, and in that vulnerability, that's where the violence occurs.
Changing the Landscape is a quite thick piece of evidence co-produced between Our Watch and WDV, Women with Disabilities Victoria, developed in partnership between our fine organisations based on national stakeholder consultation and with the strategic guidance of an expert project advisory group. It was built on to strengthen the prevention guidance that already existed, such as Change the Story, and the decades of work from women with disabilities and our representative organisations. So Changing the Landscape includes an understanding of violence against women and girls with disabilities and its dynamics and impacts. I've already mentioned these, ableism and gender inequality. When you go and have a look at those videos, you'll really get into the good stuff from lived experience, and we really want to celebrate those videos, and you'll sink your teeth into just how rich our experts speak to it. An explanation of and a conceptual model that depicts the underlying and intersecting drivers of this violence, which I'll speak to a little bit later, as well as a set of essential prevention actions that address the drivers of this violence and principles that guide how these actions should be implemented. So the evidence base and this document is useful for people involved in policy development, program funding, design, planning or implementation, as well as those working on the ground in prevention, as well as in disability services and response, as well as across the community sector. If you can go to the next slide, please, Nat, thanks. So violence against women with disabilities is reported at a higher rate than by women without disabilities. I'm going to slow down. Indeed, 65% of women with disabilities report experiencing a broader range of violence throughout their lifetime, and are twice as likely than women without disabilities to experience sexual violence and intimate partner violence. And I emphasize the word report there because that's what we know. So they're twice as likely than women without disabilities to experience sexual violence and intimate partner violence. And these rates of violence can be even higher for women with specific types of disabilities. I'm going to spend a bit more time on the next slide, please, Nat. So this quite juicy infographic describes the intersecting drivers of violence against women and girls with disabilities. And it's a figure from Changing the Landscape, which shows as simply as we could how gender inequality and ableism, which I mentioned at the beginning of when we were attempting to show a video developed out of our partnership, how they overlap for women and girls with disabilities. So on this slide, you can see how the gender drivers and the ableist drivers interlap as a Venn diagram to create the intersection between gender inequality and ableism, which drives violence against women and girls with disabilities. So on the left, we have gender drivers of violence. This is the condoning of violence against women, men's control of decision-making, and limits to violence to women's independence in public and private life. Rigid gender stereotyping and dominant forms of masculinity, and male peer relations and cultures of masculinity that emphasize aggression, dominance, and control. And on the right, we have the ableist drivers, which are the negative stereotypes about people with disabilities, accepting, normalizing violence, disrespect, discrimination against people and discrimination against people with disabilities, controlling people with disabilities decision-making and limiting independence, and the social segregation and exclusion of people with disabilities. So the evidence also suggests that prevalence of violence is experienced by Aboriginal and Torres Strait Islander women with disabilities is significantly higher than violence against non-Aboriginal or Torres Strait Islander women with disabilities because of factors such as colonisation and racism. So we have also depicted in this conceptual models the other forms of drivers of violence that women with disabilities in the community experience, including racism, colonisation, ageism, classism, heteronormativity, homophobia, biphobia, transphobia, and cisnormativity. Rates of violence are likely to be higher for women and girls with disabilities who experience other forms of oppression based off of these factors, and compounding ableism and gender inequalities that we experience in our communities and across society. Different forms of inequality, discrimination, and oppression are not separate or additive, but they intersect, mutually reinforce, and compound our experience of disability and can make it harder to engage with services or to access information when we experience violence. If you'd like to go to the next slide, we can talk a bit about the project background. So the practice resources that we developed in partnership between WDV and Our Watch, which we are extremely proud of, were co-designed and co-developed to build the capacity of target audiences to prevent violence against women and girls with disabilities. So these target audiences were identified as prevention practitioners and disability service providers, this was identified as needed to deliver changing the landscape in their sectors. But honestly, the resources are so good that anyone can put these resources into practice. That's my firm belief. And I'm going to hand over to Tess now to speak to just how we created these resources and what they look like and where you might be able to find them. Thanks, Tess.
Thanks, Lena. I'll start by chatting a little bit about our partnership. So, yeah, I'd really like to highlight the successful partnership that Women with Disabilities Victoria and Our Watch has built. It's been a long-standing partnership which was further strengthened by this project, so by the creation of the practice resources, and Our Watch are incredibly proud of our partnership with Women with Disabilities Victoria and the overall contribution that this partnership is making to the prevention of violence against women in this country. We'll go to the next slide and speak a little bit about lived experience. So, Changing the Landscape discusses the importance for lived experience voices when working to prevent violence against women. So, therefore, centering lived experience was a key principle throughout the project. We had, at the beginning of the project, we formed a project advisory group, which was made up of women who had lived experience of disability, as well as professional experience in the disability space, the prevention space, and the gender equality space. We recruited co-designers from those target audience groups that Lena just mentioned, so the disability services sector and the prevention sector, some of whom also had lived experience of disability. We checked in with Women with Disability Victoria's Experts by Experience group to make sure that we were on track and that they had the opportunity to tell us what the people, what the workforces from these sectors needed to know to prevent violence against women and girls with disability from their own experiences. And in the spirit of media representation and nothing about us without us, we ensured that all our talent were women who had lived experience of disability. We'd like to sincerely thank everyone who contributed their lived experience expertise to this project. It was wonderful working with you all, and we really appreciate the time and energy that you gave to this project. We'll move to the next slide. So now we're going to get a little bit into the detail of the suite of practice resources that we've been teasing for the last little while. So we'll move to our slides on case studies. So our case study videos are 10-minute videos. We have 5 of them, and essentially these case studies are all about bringing to life the evidence from changing the landscape through the lens of lived experience. So hearing firsthand from Talitha, Annabelle, Christine, Renee, and Laura, to hearing firsthand about their experiences as being a woman with disability. We'll head to the next slide. So we also had a different 2 types of videos. So we have our video explainers, which are, so there's 8 of these, and these cover key concepts that our co-designers said were really important for people to understand, so that they could take action to prevent violence against women and girls with disability. We'll go to our next slide. So we heard from our co-designers that quite a few people from our target audience groups spend a lot of time on the road, and we know that we're in the era of podcasts and audiobooks, and that lots of people prefer to use audio formats as a as their preferred format of taking in information and kind of processing that. So we decided to take the audio from our 2 types of videos and put it together in a 6 episode audio series that covers all the same topics as our videos, just in another format and in a different sequence. We'll head to our really cool poster slide now. So last but not least, we have 2 posters that were created as part of the resources. So these posters are on our Watch website as printable versions. So jump on, print some out to put in your workplace to get the conversation started and get people thinking. I think posters can never be underestimated in the office. So just to explain a little bit about these 2 posters. So the first poster that we have on the screen is our Breaking Down the Barriers poster. So this depicts what we are aiming for, what the world and the things that we are working towards. So some examples of that, it depends on whether how you're viewing this, whether you'll actually be able to see what is on these posters, but I'll give you 2 examples. So one of the things on this poster says choice. Says choice of where to live, learn, and work. So we know that that's really important for women and girls with disability. And then the other one is agency over money and decision making. So So that's our Breaking Down the Barriers poster. And then we have our Start the Conversation poster, which provides a variety of ways to better support women with disabilities, and how to include them in your prevention work or the work that you're doing. So some examples of this are setting up inclusive policies within your organisation, and engaging lived experience from the very start, which, not to brag, but changing the landscape. We made sure that our project walked the walk in that instance, and we made sure that lived experience was involved from the very start. This is just a taster of our suite of resources. As I said, we have, I think the statistic is over 200 minutes of video and audio content, and plus our posters. So jump onto the OurWatch website, take a look at them, and I really hope that you can find a way to incorporate this into your work. I might head back to Akii to take us to the next, take us through the next steps of the webinar.
Thank you so much, Tess and Lena, for going through the resources. Love the fact that co-design and community perspectives were represented from the beginning, and how comprehensive everything is. So that was really awesome. Thank you so much. A great resource for everyone to utilize. And now I'd like to introduce episode 8, a part of which is one of the resources, called Prevention Principles in Action. In this next video, Prevention Principles in Action, Katie shares the 6 principles of primary prevention and explains how you can apply them to your work.
In a previous video, we shared 6 essential actions to stop violence against women and girls with disabilities. Now, let's use the prevention principles to put these actions into practice. There are 2 lists of principles in Section 6 of Changing the Landscape, an evidence base developed by OurWatch and Women with Disabilities Victoria. These lists can help us practice primary prevention in our work and communities every day. Today, we're focusing on the principles for preventing violence against women and girls with disabilities. Prevention Principles List. When you're working to prevent violence as a disability service or primary prevention professional, these key points can help guide your work. 1. Raise up the voices and needs of women and girls with disabilities. Make sure their needs and experiences are at the heart of everything that you do. Create safe and inclusive spaces so it's easy for them to lead or be part of decision making. 2. Give women and girls with disabilities freedom and control. Involve them in designing programs and solutions. Let them lead the way and share their ideas. 3. Focus on strengths. Use a strengths-based approach to empower individuals and communities to build on their strengths and skills. 4. Partner and collaborate with others. Build partnerships and work together with different groups and organisations in government, community, disability, violence prevention and women's health to share knowledge and resources. 5. Be honest and respectful. Treat women and girls with disabilities with respect and honesty by sharing power and supporting equal participation. Be clear about how they can be involved and always give them credit for their contributions. 6. Keep women and girls with disabilities safe. Train your staff to support women and girls with disabilities in trauma-informed and respectful ways. Make sure staff know how to design safe, inclusive spaces and connect them to the right support if needed. 7. Be inclusive. Make sure your programs and events are accessible to everyone. Ask about the needs of women and girls with disabilities and remove any barriers so they can easily and equally be involved. 8. Use critical frameworks. Base your work on human rights, intersectional feminism, gender equality, and the social model of disability. These frameworks help us understand and address violence better. 9. Share what you learn. There's not a lot of information out there about what does and doesn't work to prevent violence against women and girls with disabilities. Documenting and sharing your findings can help others learn from your experiences. This is just an introduction to the prevention principles that can guide us in preventing violence against women and girls with disabilities. Check out other resources and videos about changing the landscape to learn more about how to prevent violence.
This video is part of a suite of Changing the Landscape practice resources, produced in partnership by Our Watch and Women with Disabilities Victoria, and supported by the Australian Government Department of Social Services. We thank every project participant that has helped to make this practice resource series. Thank you for generously and boldly sharing your experiences, expertise, and for your leadership in calling for much needed change. Visit ourwatch.org.au or search Changing the Landscape online to find out more about our work and steps everyone can take to prevent violence against women and girls with disability. Violence is not inevitable, it is preventable. Our Watch, Women with Disabilities Victoria.
It is a wonderful taste of the resources from Changing the Landscape project, all of which have women with various disabilities, some that are hidden, some that are obvious. And thank you to Katie who was in that video discussing the 9 principles related to prevention principles in action. And now we're on to the panelists. We have an incredible lineup of panelists. And firstly, we have Carly and Myers AOM. Carly's pronouns are she, her, and Carly is a gender and disability advisor at Women's Health Grampians, focusing on projects addressing gendered and ableist drivers of violence against women with disabilities. Using her lived experience, she advocates for the voices of women and women with disabilities to be centered when decisions are being made on issues directly affecting them. Carly has built partnerships across women's health, disability, local government, and the community sector, delivering inclusive and accessible resources, training, community engagement, events, and campaigns focusing on the prevention of violence against women with disabilities, sexual and reproductive health, and inclusive and accessible healthcare. Carly has recently been appointed to Victoria's Our Equal States Reference Group, providing strategic advice on implementing Our Equal States Victoria's Gender Equality Strategy and Action Plan 2023 to 2027. In 2024, she received the Order of Australia Medal for her volunteer work and advocacy work. Next, we have Kristy, whose pronouns are she, her, and is an experienced peer worker, disability advocate who has been working at WILD, WWILD, Sexual Violence Prevention Association for the past 4 years. Kristy has lived experience of intellectual disability and is a survivor of domestic and family violence. In her role at WILD, Kristy has worked on the Listen Up project, which focuses on the prevention of violence against women and non-binary people with disabilities through the creation of a suite of resources which were co-designed by people who have intellectual disabilities, including podcasts, booklets, videos, and online training. Currently, Kristy is delivering training to services in the ACT, which focuses on best practice when working with people who have an intellectual disability who have experienced violence. Our next panelist is Jane Barrett. Jane, she, her, is a senior project worker at WILD, Sexual Violence Prevention Association. Jane has worked with WILD for the past 10 years, supporting people with an intellectual disability who have been a victim survivor of sexual violence, domestic violence, and family violence, or are at risk of experiencing violence. Jane's work at WILD has included case management, advocacy, group work, crisis support, community development training, and project management. Jane is currently a senior project officer and has been the project manager for the Listen Up project and the ACT training program. Both projects focus on the prevention of violence against women and non-binary people who have intellectual disability through the creation of various resources and co-designed with those people with disabilities within the community for training and community education. And our final panelist is Hannah Dwyer. Hannah's pronouns are she, her, and Hannah is a prevention sector development advisor at Safe and Equal, where she leads the Partners in Prevention, PIP, network, and supports the delivery and implementation of all programs related to the prevention sector. A primary focus for Hannah is to support and increase inclusive and accessible practice. Through her work, she aims to center lived experience of disability and embed promising practice across the work of primary prevention team at Safe Equal. So we'll hop right into the questions for the panelists. The first question is, can you please tell us about your work and how you've applied changing the landscape in practice? For example, the essential actions or principles. And Kali?
Thank you, Akii. Well, last year at Women's Health Grampians and the Communities of Respect and Equality Core Alliance received funding from the City of Ballarat and the Department of Justice Empowering Communities 2022 grant to engage with 4 members of the Women's Health Grampians Core Alliance that's based in Ballarat to support these organisations to prevent violence against women with disabilities and improve safety and respect for women with disabilities in the Ballarat community. The project actually had several parts, and each were guided by the essential actions and prevention principles highlighted in Changing the Landscape. And choosing just one prevention principle to highlight the project, it would have to be co-design, as that was implemented from the beginning and embedded throughout the project, starting with the funding application to project development, to delivery, to evaluation, and then acquittal. So Women's Health Grampians was committed to this project to be led by and with women with disabilities. When Women's Health Grampians engaged me as their gender and disability advisor and 3 of the equality advocates, women with lived experience of disabilities, to deliver the program. We did this through a co-design process, centering the voices of lived experience throughout the project. The essential action I would have to choose would be action 3, improve attitudes towards women and girls with disabilities by challenging ableist and sexist stereotypes. Myself and the equality advocates shared very negative experiences as women with disabilities accessing public and community spaces in and around Ballarat. We could see these experiences were a direct result of ableist and sexist stereotypes and attitudes, which we knew we had to challenge if we were to see any positive change. So we started the co-designs with the equality advocates on a fortnightly basis over Zoom. We had a total of 20 sessions in all, and through their initial training as equality advocates, they were already familiar with Change the Story. So as part of the co-design sessions I did with them, the first one I spoke to them about changing the landscape and how the framework will inform our project, which was very, very important to have that established right from the beginning. And so the equality advocates then applied their lived experience to the co-design, delivery and promotion of the following pieces of work, which were 3 pieces all up. So I know we're short on time, so I'll try and be quick, but give you enough detail. So we began with an action toolkit for core members, community groups and organisations about taking action that is inclusive of women with disabilities. This included staff training session for each of the core organisations, looking at the ableist and gender drivers of violence against women with disabilities and the essential actions they could take to prevent violence against women with disabilities. This was followed by 2 workshops on how to use the action toolkit, including the accessible mapping, audit and action plan. And that was focused on, again, around prevention of violence against women and girls with disabilities. And so they looked at key areas, and we chose leadership and management, human resources, promotion and communications, programs and services, and attitudes and capacity. And that was influenced initially from the WDV's Women's Health Services Auditing Toolkit from many, many years ago. So utilising the action toolkit, the core organisations identified and addressed the gender and disability equality gaps and needs in their organisational processes and practices. They looked at ways to promote gender and disability equality within their organisations and what workplace-specific initiatives they could initiate that promote inclusive, accessible and respectful working relationships, and how they can introduce and sustain these initiatives. And then they had to choose or adopt at least 2 actions to prevent violence against women with disabilities. And these actions were then added to the overall, to the organisation's overall core action and mapping plan. And the 4 core organisations we worked with were Ballarat Community Health, City of Ballarat Parent Place, Ballarat Centre Against Sexual Assault, and BGT. And then the other 2 parts, which I'll briefly touch on, from this work, we developed a community of practice, which had a tagline, be part of the solution, building on a foundation of knowledge and respect to improve the daily experiences of women with disabilities in Ballarat. So it was, again, just to focus on how core organisations could address the gendered enablers drivers of violence. And it occurred during the beginning of the 16 days of activism against gender-based violence from last year in 2023. And it was used to help promote the social media campaign, which was then launched a few days later on the 3rd of December, International Day of People with Disability. So the event was aimed at core members in the Ballarat region and across the Grampians, to organisations that we had not yet engaged with in the project. And it was to showcase the accessibility for pilot project as an example of best practice when engaging with women with disabilities in gender equity and prevention work. And then to finish it off, we had a community campaign on safety and respect. And its wonderful tagline was real inclusion starts with respect, be part of the solution. And that was a social media campaign promoting the safety and respect of women with disabilities in the Ballarat region using an empowerment model. And it was directed towards core organisations with the emphasis of importance of inclusive practices and attitudes. And it was co-designed with our 3 equality advocates again, and featured the advocates Annabelle, Christine and Heidi. Now, just a side note, Annabelle and Christine are also featured in the new Our Watch WDV resources, which we were really, really proud to see. Yes, so that was that's how we did that and how we applied the principles and essential actions. Thanks, Akii.
Thank you so much, Carly. That was incredibly comprehensive, and it was really great. Obviously, having co-designed from the get-go, but also when you highlighted the endorsement of picking certain strategies to really implement in their daily practice, because obviously we can do all of this work, but if it isn't implemented with measurable goals to work towards, then it's not as easily applied in everyday practice. So that's really awesome. Thank you so much for your very comprehensive answer regarding that question. On to Jane and Kristy regarding telling us about your work and how you've applied changing the landscape in practice. For example, the essential actions or principles.
Thank you, Akii. Hello, everyone. So Kristy and I, hello from Queensland. So we're from Wild. So we work with people 12 and up who have an intellectual disability and have experienced violence, including sexual violence, domestic and family violence, or other violent crimes. So for the last few years, Kristy and I have been on the project team at Wild. And the project we're really excited to share today is called the Listen Up Project, which ended up being a 4-year project in total. So the aim of our project was to create a co-design a suite of resources with women and non-binary people with lived experience of intellectual disability around prevention of violence. So our project had a number of different stages. So the first was to recruit people with lived experience of intellectual disability onto our project team. So throughout the project, we had 3 women with intellectual disability on our team who developed the workshops, facilitated training. So Kristy Hill, my colleague, has been with, we've been working together for longer than 4 years actually.
Yeah.
Anyway, I go on. The second step of our project is we started to run psychoeducational workshops across Queensland, sharing knowledge around violence within relationships, people's rights within relationships, but also people's rights when accessing services after experiences of violence. From here, we started doing our co-design workshops where we focused on, okay, so what do you want the community to know about people's experience of violence, people who have an intellectual disability, and how do we hope this will prevent violence? Overwhelmingly, the experts in our projects, which were 33 women and non-binary people, really wanted to challenge stereotypes around intellectual disability. People were also really interested sharing knowledge with services who support people after an experience of violence around intellectual disability, accessibility, and ableism. So from here, the NG Think You're the Expert website and project was born. So this website has all of the resources that were co-designed during this project, including a series of podcasts which were hosted by the experts, which share advice around what they would like to see from different services supporting women who have an intellectual disability. We created a series of animation videos that focus on different myths and stereotypes around intellectual disability, which were all voiced by the women and non-binary people in our project. We created online training, which the aim was to share knowledge about the project, but also to share knowledge with services supporting people with intellectual disability about identifying intellectual disability and working alongside people with intellectual disability in a trauma-informed way. So I think when Kristy and I sat down and we talked about the principles we wanted to share today, the 2 that came to mind for us were about raising the voices of people with intellectual disabilities and ensuring that freedom of control of the project was always in the hands of the experts. So Kristy, did you like to share how we did this?
Yes. We did it by giving people a chance to build up confidence and speak up. We did this by running lots of group and listen to people, letting people know it's okay to use their voice. We would do activities in their group so the experts could practice using their voice in their group. We would plan activities so people could share their ideas in lots of different ways. We use craft and brainstorming games and one-on-one discussions. Some people find it hard to speak up, so it was helpful for people to practice. Being there for people and listening and not judging helps people to use their voice. We listen, not judging. Make sure they had freedom and control in their project by asking them what was they wanted to change in their community and what resource they would like to make. We call the people in the group the experts. They are the ones with the ideas and the knowledge. People have been through it. They have lived the experience of the disability and violence. They know what needs to be changed. They just need people to listen to them. most people don't listen. By calling the people the expert, we were really trying to change the way people think about people who has a disability. That there is a myth that people with a disability could make their own decisions or don't have any ideas, but it's just not true.
Thank you so much to Jane and Kristy for sharing your experiences and that project, really recognizing that the freedom of control should always be in the hands of the experts, which are the people with lived experience. And that relates back to what Carly mentioned, that real inclusion starts with respect and listening. So thank you so much for that, Jane and Kristy. And on to you, Hannah.
Hi, I'm Hannah. I use she, her pronouns. And today I'm wearing a navy top with gold hoop earrings with medium length dark brown hair. I'm dialing in from Wurundjeri country in Melbourne, and this land always was and always will be Aboriginal land. As Akii has already mentioned earlier, I work in the primary prevention team at Safe and Equal, the peak body in Victoria for organisations that specialise in family and gender-based violence, and that's across the continuum, so including primary prevention, early intervention, response and recovery. I lead a program of work to support prevention sector development with a focus on capability building for practitioners. And so essentially to do that, we run lots of events in person and online. And this includes one of our largest events, which is called Preventex, and it's a national conference for prevention workers. While I am speaking from the Victorian context today, and not all jurisdictions have a provider in workforce development, I just want to note, which has already been noted today, but that accessible and inclusive practice can be done by anyone and should be done across all sectors. And everything I know about increasing access and inclusion is by hearing from, so reading resources or watching videos like we've seen today, and listening to the two women with lived experience of disability. Prevention principles that guide the work that I do and my prevention team does, on top of the general prevention principles, are centering the input of women and girls with disabilities, building partnerships and opportunities for collaboration with women with disabilities, and to always ensure accessibility and inclusion across all of our prevention activities. About 3 years ago in our team, we completed the prevention of gender and disability-based violence audit toolkit that Carly had already mentioned they used in their partnership. And the toolkit was created by Women with Disabilities Victoria. And this was incredibly important in shaping our practice within our team. And the toolkit allowed us to assess what we were doing to increase inclusivity in our prevention work and identify areas where we could improve. There's obviously always room for improvement. Participating in the audit supported us to review our own practices, but then also to embed and role model these through our work. What we found was that there were many ways we could plan for increasing accessibility across all of our products, and I'll just run through some examples of what we've done and what that looked like for us. I first wanted to talk to the acronyms in the prevention of violence space. There are so many of them and they're used a lot. And one way that we try to combat this is, instead of using an acronym, to use the whole word and the names of organisations and programs. And this helps everyone understand who and what is being spoken about. Centering the experience of women and girls with disability. And I know Tess said not to brag, and all the wonderful programs that have been presented here today, but really, like, they do centre, and the resources presented today lived experience is centred from the start, and that's incredibly important, obviously. And in program planning, we think it's really important to have someone with a disability on your planning group, and to avoid adding a disability lens at the end when the program or product is already too far along in the planning stages. And that one person on your planning group won't be able to speak for everyone with a disability, but they will have a general overview of ways to incorporate the voices of those with lived experience. And if there are times when you need further input from those living with a disability. Hearing from those with lived experience means allocating budget for this at the start of planning. And for our National Prevention Conference, which I mentioned before was called Prevent X, we do budget for a consultation with the Women with Disabilities Experts by Experience group. And this supports us to implement a gender and disability lens to the conference, both the content, like the agenda essentially, and it also supports with access improvements for the platform that we also hosted on. We also close the loop after the conference with a feedback session from our consultation with the group, and we share what we implemented. They kind of give further feedback around the suggestions that we took on or where we can continue to improve. I probably should have mentioned this earlier, but it's seems like a very simple thing, but it's always really important to ask people's support needs for every event, including attendees and also the speakers, and never assuming what people may or may not need. Budgeting for Auslan interpreters, if requested, and live captioners at every event. And we know that live captioning is helpful for so many different people in so many different communities. Another thing to consider is understanding how Auslan interpreters like to work, and how we can work with them to make sure those they are speaking to or translating for on the day, so to make sure that the speakers that are presenting at the event are speaking at a reasonable pace for our Auslan interpreters to translate correctly for the Auslan user. And this increases the user's experience as well. Increasing accessible spaces for in-person events. And this could include things like comfy, soft seating, the opportunity to stand or have space around the room for people to move around without interruption. And considering quiet spaces for people to take some time out if needed, and ample breaks in events, both online and in person. And similar to today, we aim for about a 5-minute break every hour. One thing that we'd like to get better at probably is learning more about asking our MCs and facilitators to use audio cues in our conference to kind of set up the day and what it feels like and what it looks like, and creating a space where everyone attending is considered. I'm just aware that we are running a little over time, so I'll wrap it up there. But I think I'll just finish with one more important thing in my practice is to constantly check in, reassess, and always question our processes and practices, and especially working in a mainstream organisation, and just constantly questioning and challenging the way we may be currently doing something and adapting as we learn more. I'll hand back over to you. Thanks, Akii.
Thank you so much for that, Hannah, and all of you, Carly, Jane, Kristy, for your contribution to that question and your comprehensive answers, really reflecting and highlighting the significance and the crucial component of co-design from the beginning, but also budgeting in advance from the get-go so that you include and incorporate and implement inclusion and accessibility in everything that you do if you consider it first and foremost. So on that note, we will take a quick 3-minute break. Just have a cup of tea, stretch, use the bathroom, whatever you like, and we'll catch you back in 3 minutes. The next question is about providing an example. Can you provide an example of how you have used or plan to use changing the landscape practice resources? Carly?
Thanks, Akii. Well, for our program, we use Changing the Landscape as well as WDV's Taking Action Guide and Understanding Disability video to inform the training presentation. We showed the Understanding Disability video at the beginning of the training to provide context as to who we are talking about and why. This was followed by presenting the evidence taken from Changing the Landscape and WDV's Taking Action Guide to demonstrate the enormity of the problem and the intersections of impact. And then with Changing the Landscape, we use this more to explain the why, why women with disabilities experience violence, focusing on the intersecting drivers of violence and what essential actions they, as individuals and as an organisation, can take to prevent violence against women with disabilities. And during the training sessions, 2 of our equality advocates presented their lived experience, highlighting their experience of ableism and gender inequality and their calls to actions that aligned with the essential actions. And as this was a pilot project, we were testing the delivery format, and now we are adjusting it to include the new Changing the Landscape resources. We'll be including the case studies as part of a pre-reading with a selection of questions, which is still being decided upon. The participants will have an opportunity to discuss their answers during the breakout sessions during our training. We think watching the case study videos before they hear the theory would be more impactful, as we found some participants struggled with how the theory applied to them. One equality advocate also noted that some of our participants seem to have resistance around language around violence and where this fits with them. So by providing the case study videos to watch beforehand and then hearing from the equality advocates centering their lived experience within a workplace environment to demonstrate where we see this behaviour and how this can enable violence, such as clinical settings, for coercive control, looks like this, and this is how you deal with it. Another idea, we may use one of the case studies and apply to the core organisation's work environment so they can see how prevention of violence against women with disabilities can apply within their environment. And because 2 of the presenters in Changing the Landscape case study videos are equality advocates who are a part of the training, it's a great opportunity for participants to hear from them directly. So we ask the core organisations to demonstrate how they promote the essential actions in their workplace, and we begin work on their chosen areas for improvement by looking at the audit questions the equality advocates have come up with, which tie back both to the essential actions and the prevention principles from Changing the Landscape. And then in the workshops following the training, we work with the organisations to continue working on answering the auditing questions for their chosen areas, and the equality advocates who present at the training session also attend the workshops, and they use their lived experiences to support the discussions on the auditing questions they provide. Doing that, they provide invaluable insight into the prevention of violence against women with disabilities, which help the participants to work through those auditing questions more effectively. And then this then informs the core organisations of what actions they would like to adopt to support the prevention of violence against women with disabilities within the workplace. And the actions then are added, as I said before, to their overall mapping and action plan, which is monitored over the coming years. And I know that's a lot of detail, but to try and get that into a little short synopsis is very, very difficult. I apologise. Thank you.
No need to apologise. Thank you so much, Carly. That was very, very detailed and absolutely great. And Jane and Kristy, sorry.
Thank you. I think when Kristy and I sat down to talk about this question and we watched all the videos together, just naturally we started reflecting on particularly the principles and actions video, reflecting on the principles that we used in our work, giving examples of these, having discussions around things that we would like to do in the future. And I guess I think for us, it will continue to be something that is used, reflected on, and to ensure that it's underpinning everything that we do at WILD within all of our work, regardless of that project, case management, counselling. And I think in terms of future planning to ensure we're using this information in our project plans when we're going for funding is something that sort of struck us when we just naturally started talking about it. For you, Kristy, how would you use these resources in your practice?
Well, we also running training and service about working with people who have a electrical disability and have experienced violence. We use this information from our watch in their training to help people to understand what drive violence against people who has an electrical disability. It is important that this type of information is shared with others so people know how to help people with disability. I think it's important for people who has a disability to do this, the training to share this type of information.
Thank you.
And I hand it over to you now, Jane.
And I'll hand it back.
Thank you so much, Kristy and Jane and Hannah.
Thanks, it's Hannah speaking. While this is not a piece of work that I am working on, but one of my colleagues, Brittany, is leading, Safe and Equal are currently partnering with Women with Disabilities Victoria on creating a suite of e-learns, which includes input from women with disabilities, gender and disability experts. And the e-learn will reference the materials from Changing the Landscape, including the drivers of violence against women and girls with disabilities, and will include case study videos from the updated Changing the Landscape resources, which is why we're here today. And the resources in the form of an e-learn will be available sometime in 2025. There will be a focus on the impacts of service delivery for those working with victim survivors of disability. However, the e-learn will be of value for practitioners across the continuum. And the suite of resources that we've been talking to today, as you know, are for practitioners that are working to increase disability inclusive practice. But as Lena already mentioned, they are so good that I think anybody out there could put these resources into practice. I won't take up too much time. We're running short of time, but I think one of the roles of Safe and Equal is one of the most important roles of Safe and Equal is to elevate the leadership role and the work that is happening in community-led organisations across the sector. And so with these resources, we want to make sure that our practitioners that we work with are aware of them, and we do that by sharing them across multiple platforms and bulletins, etc. But the other thing is also making sure that once these resources exist, and how practitioners want to incorporate them into their work, and so we want to continue to bring visibility and value to the role, but of community-led orgs, but to do this we need to obviously advocate for increased funding and point people in the direction of these organisations, for example, Women with Disabilities Victoria, so that when people want to work with them, they are well funded to do the work and work with the prevention workforce. So I think that's probably the most valuable thing, to make sure that these programs and projects are well funded, valued, and can continue. Thanks, Akii.
Thank you so much, Hannah. Absolutely agree with everything you've just shared. It's been great having our fabulous panelists, Carly, Jane, Kristy, and Hannah. And now we just have some time for some Q&A. if anyone has any specific questions. Otherwise, actually, I have a question here. The question is, what is a key takeaway in relation to prevention? So, what is a key takeaway or insight in relation to your work in preventing violence against women and girls with disabilities? And this is to all of our speakers and panelists. So, we start with Hannah, if that's okay.
Was that me, Akii?
Yeah, yes.
Yeah, gorgeous. It's Hannah speaking. So I think the most important or key takeaway from me would be that, and it's already been mentioned today, but ending violence against women and girls with disability is everybody's business, and creating change is a process and a practice, and building confidence in the work that you do to create that change, and then shift and change and remain agile where you need to. And I think sharing your knowledge, which has already been shared today, but I think it's really incredibly important. And I know this for me, like sharing it with my team, sharing it with other practitioners, making sure you're, sharing what works and what hasn't worked, and the ways that you're kind of working to continue to improve that disability inclusive practice. Thanks, Akii.
Thank you, Carly and Jane and Kristy. What would you like to add, Carly?
Thank you, Akii. I think we've talked about it a lot, as it is a theme. I think because we centered the voices of lived experience throughout the project, we could say that the project was completely co-designed, and we use this to demonstrate to core alliance members what best practice looks like when you prioritise the voices of women with disabilities in the design and delivery of prevention of violence against women with disabilities projects and activities. And doing it this way, it was not just respectful of the rights of women with disabilities to contribute to prevention activities, it also gave all of the project components from the action toolkit to the social media campaign credibility. And we felt that when you do co-design well, it produces meaningful outcomes for not just the people who benefit from being part of the training and workshops, but also the equality advocates. And we could say that they reported throughout the project that they felt heard more, and also their experiences of feeling disrespected and not safe in the community and public places were believed. And that was really, really important to be able to present that truth to participants, and understanding that they were giving the lived experience experts that space and that respect to be able to talk to their own experience of ableist and gender drivers of violence. So, yeah.
Thank you so much, Carly. And lastly, we'll go back to Kristy and Jane.
Thank you. I think for me, a key takeaway, and again, we've sort of talked about this in lots of different ways, but if we're going to be working in the space to prevent violence against women and girls with disabilities, we need to be including women and girls with disability, including people who have intellectual disabilities in these discussions. So for us, it was really including in our project planning that we had time to build relationships with the people with lived experience who were going to be involved in our project. We were lucky to have a project that did go for a number of years, and that we were meeting people quite regularly. For people who have an intellectual disability, it can often take some time to build trust and feel comfortable to use your voice, to be on podcasts. The second thing I think is ensuring that you're considering accessibility in all aspects of your project, whether if that's looking at easy read documents, policies for our peer workers, and having ongoing discussion around accessibility and what that means for people who are participating in the project. Kristy, for you, what was a key takeaway from the project that you
for me, it is the importance for me is listening to people, believing them, help them to raise their voice, treating them with respect. If people aren't able to speak for themselves, it's our job to speak for them.
Thank you.
So much for that. That's so crucial in all the work that you've done today, really highlighting that it really needs to be embedded, recognizing that no truly effective solutions can be created if the people impacted by them aren't involved in the process. So that is a very core component of the work that needs to be done. And we are about to wrap up for today. So if you could, before we go into finalizing today and saying our goodbyes, I'd love if you could take out your phones and scan this QR code to take a quick 60-second survey on this session. It's also in the chat if that's easier for you. And of course, it's entirely voluntary, but we really do appreciate your feedback. It really helps us get a sense of effectiveness of our content and for our evaluation and ongoing work in this space. Jess will also drop some information about the data collection policy into the chat. So I just wanted to say a huge thank you to everyone that shared today, Tess, Lena, Kristy, Jane, Carly, and Hannah. Thank you so much for your wealth of knowledge, your experience, and your expertise. Really wanting to highlight that the Change in the Landscape project and all the resources are essential actions and prevention principles, and really able to be utilized to guide work in preventing violence against women and girls, and making sure that co-design is centered and using examples of promising practice from across Australia by doing whole of organisation approaches and ensuring equity within the work that you do, and training delivery, policy and practice, service delivery, and all the work that you do to ensure that there is an equitable, accessible lens. And Changing the Landscape practice resources can also, of course, be used by anyone, specifically in the prevention space, and to take the opportunity to, please take the opportunity to explore these resources, become acquainted with them, and consider ways that you can incorporate them into your prevention activities, whether they are large or small. You can access all of that on the Our Watch website, and also on the screen being displayed. There are a number of support services that you can access. And I would like to really thank you all again for making time, to all of our wonderful participants today, as well as Our Watch and Women with Disabilities Victoria. You can connect with us with Our Watch and Women with Disabilities Victoria on all social platforms, Facebook, Instagram, X, Twitter, and so on. Thank you again to Carly, Kristy, Jane, Hannah, and Jess, our digital moderator, and everyone at Our Watch and WDV who made today happen. And to sign off today's webinar, remember, violence is not inevitable. It is entirely preventable. Violence against anyone, but especially women, girls, and those of marginalised genders, is incredibly important to identify and tackle due to the disproportionate rates of violence that we face. Thank you all for attending. I really hope you have some great key takeaways from today, utilising the Changing the Landscape resources. Thank you so much. Have a wonderful day.